Good afternoon. Lee Harris, Mayor of Shelby County, pleased to be here on behalf of the Joint Task Force. As some of you may remember, a few weeks ago we initiated a COVID Community Council. The goal is for members of the COVID Community Council to spread the word during the summer months about the importance of vaccination. And we have received a lot of interest in serving on that COVID Community Council. And so I want to thank everyone who expressed an interest in serving. And we are well positioned to do some really important work in that council. As a result, we have a lot of talented people that are set to get started in the first formal meeting next week, although our activities and our planning have already begun. The membership of that council includes essential workers like nurses and teachers and grocery store workers. In addition to that, we have members of the council, folks with a unique perspective. We have COVID survivors, immigrant advocates, and those who've had to navigate COVID this year on behalf of special needs children. We also have folks that have loved ones who did not survive during the course of this pandemic. It includes Spanish speakers who want to try to get the word out to the Latinx community, and it includes high school students who want to increase uptake among teenagers. Again, the best strategy is to make sure that everyone talks to their peers and their networks about the importance of the vaccination. According to the Kaiser Family Foundation, people who know someone who have already received the vaccine are more than 40% likely to get vaccinated themselves. The idea is simple, and it is this: people are motivated by what folks in their community and in their networks and in their households are doing. And so we're optimistic about the new members of the COVID Community Council, our ambassadors, if you will. We are hopeful that they'll put out relevant and accurate information about the vaccine and where you might get the vaccine. But whether you are a member of this new council or not, each of us have a role to play. Each of us can get the word out to our friends and our loved ones and our coworkers. So thanks to all of you for sticking to this. We're 14 months in, and we are almost there, but we still have a ways to go. At this time, I'd invite to the podium David Sweat.
Thank you, Mayor, and good afternoon. David Sweat, Shelby County Health Department Deputy Director. I'm here to give you an update on where we are with the pandemic. We've had 95,944 cases of COVID-19 disease diagnosed in Shelby County so far, so we'll go over 96,000 cases, I'm sure, today. We've had 1,620 deaths in Shelby County so far. That 95,944 cases includes 94 new cases that were reported to us yesterday. In surrounding counties, 7,314 people have been diagnosed in Tipton County so far. 5,032 people have been diagnosed in Fayette County in Tennessee. 5,658 cases have been diagnosed in Crittenden County, Arkansas. And 21,429 cases have been diagnosed in DeSoto County, Mississippi. So as far as where we were on the vaccine campaign, just want to say, first of all, thank you to the 212 people who came out on Sunday and got vaccinated at the Cinco de Mayo event at El Mercadito. That was a wonderful response. We actually had to send people back twice to get more vaccine because more people kept coming to be vaccinated. So thank you to that response. And thank you to everyone of the 316,062 people who have come forth and presented themselves and gotten at least one dose of COVID vaccine so far in the campaign effort. We've had 95,335 people who are partway through their two-dose series, and 220,727 people who are fully vaccinated as of yesterday in Shelby County. But what we know from other analysis is that we kind of have an equal number of people susceptible to be infected and vaccinated at this moment. So we've got about an equal population of people who are vaccinated with at least one dose as to the number of people who have no antibodies, no immunity to the virus whatsoever. So we're in a tug-of-war moment, a pivotal moment in the epidemic, where we have the virus in our presence that is a variant virus and more transmissible, and equal numbers of people who are susceptible and vaccinated. And right now, we need to keep pushing to tilt the balance of power in our favor and away from the virus. And for an update on our progress on that effort, I'm going to turn it over to Chief Doug McGowen.
Thank you, David. Very pleased to be here today. And as David said, we're thankful for so many people who've given us the opportunity to give more than 536,000 vaccines here in the community. And the work continues. We still have a very high volume of capacity available at all of our sites. And we're hopeful that people will come on out and make themselves available to the vaccine. I mentioned last week that we have a new walk-in site that is actually seeing some traffic at the Jackson Avenue. That's the Gateway Shopping Plaza on Jackson, which is administering the one-shot J&J vaccine there. So if you're interested in that, in addition to what we did over the weekend for the Cinco de Mayo event, and we'll have some other additional offerings of J&J throughout the week, come on out to the Jackson Avenue site for J&J. You've seen in the news that recently Pfizer has begun the work of getting approval for reducing the age of vaccine down to 12 years old, so 12 to 15-year-olds. We expect that sometime in the next week or so that they should come out with that authorization. For us, we will treat it exactly as we did when 16-year-olds were authorized. You'll need a parent to come with the child to sign the consent form. But we're looking forward to that so that we can have even more of the population available to get vaccinated. But again, you'll have to have a parent or guardian with the child to sign that consent form. David just mentioned that we're really at this pivotal point. As you all know, we have about 2 more weeks with our community vaccination site over at the Pipkin building, where we have a very high volume. We have about the same number of people vaccinated as are susceptible to the virus itself. And so this is the time to really, let's push us over the edge. And I couldn't be more pleased today to offer something that I think will get us excited. In addition to the community council where people can share their stories, let's have folks share this story. We are announcing today what we're calling a shot for a shot sweepstakes. If you want to pull that up for me, there it is, the website, wearememphis.com, shot for shot. If you'll go onto that website, you'll see that if you get vaccinated, you have a shot to win a new ride. That is a new vehicle of your choice, a Chevy Camaro, a Chevy Colorado, a Nissan Rogue, or a Nissan Altima, or if you don't like any of those, another vehicle of equal or lesser value. You only need to have been vaccinated, or you need to get vaccinated, and you're eligible to enter. You can go to the wearememphis.com website. You can call in to 222-SHOT, but I need everybody to do that before May 31st. Get vaccinated and enter the sweepstakes before May 31st. Now, the contest is only open to Shelby County residents, and that is people who reside in Shelby County. It doesn't matter where you got your vaccine, but we need to see that you have your vaccine card. You have to be 18 years or older in order to win, and you have to prove both that you live in Shelby County and that you have been vaccinated. We're only taking 1 entry per individuals, and the period of entry ends at the stroke of midnight on May 31st, 2021. On or about June 1st, we will select a winner at random from all of the entries that we have seen. And if you're looking for more rules and regulations, you can please just go to the website that was displayed there at wearememphis.com, shot for shot, and you'll be able to see. So we've done some incentives in the past. We've done some gift cards. We've given rides to vaccine. I know that there are folks who are hesitant, folks who think I can wait, but we put you on the clock. The sweepstakes to win a new car in exchange for getting a vaccine expires on May 31st at midnight. So come on out. If you've had a vaccine already, please go to the website and enter yourself for a chance to win. If you haven't had a vaccine, you can go to any of the vaccination sites any of the private sites, any of the public sites, get your vaccination, and then you can go online and enter yourself for a chance to win that brand-new car. So with that, I'll stop and take any questions you may have.
Brad Broders, Local 24.
Good afternoon, everyone. I don't know who would be the best person to answer this, and I know Mayor Harris, you touched on this a little bit on Friday at the gardening event, but any new updates regarding leaning one way or the other on potentially lifting business restrictions or indoor mask mandates in the next health directive? And I'll follow up.
Hey, thanks for the question. I don't think anything's changed in terms of our timeline. The health directives come out every 30 days, and so we're set for May 13th. The numbers have been relatively stable, although we'd love to see them get lower and even lower still, but we're still on pace for May 13th. So working hard to meet with all the relevant public and medical health professionals to make sure we fully understand the data and that we're in a place to issue on May 13th with an effective date of May 15th. And if I could just make one remark here about the last shot for shot. I think that's a great offering from the city of Memphis, and we're really pleased to hear that this afternoon. And I love the idea of the Meth Pop. So shout out to Meth Pops for those who got Meth Pops when they got vaccinations. But this is a really exciting opportunity. And based on the examples he had, it's an opportunity to get a Chevrolet. And so that's one of the best companies around. And my first car was a Chevrolet, by the way. So I had some great experiences there. So it's another great opportunity for someone out there to get a Chevy just for doing their duty and considering vaccination. Now, was there a follow-up on that last question?
Yeah, thanks, Mayor Harris. So this question is my follow-up to David. Anything new since the last week regarding any new variants that have been discovered or any additional cases of that B1617 strain?
Right. Thank you, Brad, for that question. And no, we met with the laboratory directors yesterday, and right now it's a little quiet. We continue to have preponderance of cases being the B117. The case that we reported last week where it was travel associated, returning traveler from India with one of the variants that is circulating there, currently isolated. We have not detected any further instances of that at this point in time in the sequencing data. There have been some variants out of New York and California here in the United States that continue to pop up from time to time and on the most recent run. I would like to also, though, say that still testing is really one of the most important pieces to the process and the puzzle. And without people continuing to come out and be tested, whether they have symptoms or they've been exposed, we wouldn't have the stream of information coming in that can go to the laboratories to be sequenced to tell us what kind of viruses are circulating in our community. And the Shelby County Health Department will be working once again to do an outreach testing event this Thursday, May the 6th, and we may have a graphic about that can be pulled up. So it's a testing event at New Growth in Christ Christian Center, 7550 East Shelby Drive in zip code 38125 between the hours of 10 a.m. and 1 p.m. So anybody 5 years old and up can come and be tested during that window of time. And if you're not able to avail yourself of that opportunity, we continue to have over 16,000 community-supported test sites and appointments available throughout Shelby County. But anybody who has been exposed to a case, or anyone who has returned from travel overseas into any part of the world, anybody who is having symptoms and feels like they may be COVID related and they want to know their status for sure, we want to continue to remind people to come out and be tested, because that's the first opportunity we have for you to know your status and for us to help you get into isolation quarantine, find out if you need additional assistance to stay there during the period of time you need to be there, but also to get that information to the laboratory so we can continue our surveillance for emerging variant viruses.
Mandy Rock, Fox 13.
Hey, good afternoon, everyone. The American Academy for Pediatrics released this new report saying that children now make up 22% of all COVID cases nationwide. So can you tell me if that's a similar concern here locally and if we're seeing an increase of cases in children? And I have a follow-up.
Yes, thank you for the question. I saw that report this morning, and I did look yesterday at some data that we do analysis inside the health department for the different mayors of the various municipalities, but one of the things we track in that report are infections among children. I don't know. I haven't asked the data team to tell me the proportion in, say, the last week or two of the cases that were pediatric cases, people less than 18 years of age. But I did see that same report, and nationally, that's what they're seeing, that it's 22% of recent cases are among children. And one of the likely contributing factors to that is that our older population, people 65 years of age and older, have been vaccinated at least 70% of the population in those older age groups have now been vaccinated. So the virus is opportunistic, and the virus is just going to go wherever it's able to transmit most freely. And right now, because children cannot be vaccinated, they represent an opportunity for the virus to get established and spread. But we'll look into that and report on Thursday what proportion of our local cases are pediatric cases. But certainly there's an increasing trend nationally of pediatric cases.
Thank you. And just going into my second question, now that the FDA is expected to approve the use of Pfizer for children aged 12 to 15, as you mentioned, how will that impact this and affect our ability to reach herd immunity in the county here?
Right. It increases our opportunity, because in order for us to really get the biggest bang for the buck and the benefit to the community of the vaccine is not just to have individuals take the vaccine to protect themselves, but to have enough people in the community vaccinated that the virus crashes, and we call that herd immunity. And for COVID virus, typically we would estimate that we'd need at least 70% of the population to be vaccinated. So having the vaccine available for people as young as 12 years old just increases the number of potential people who are eligible for vaccination or will be eligible for vaccination, and that would make reaching the herd immunity level easier to do. So we continue to watch expectantly for the FDA to act on this emergency use authorization, we hope.
Kelly Roberts, WMC.
Good afternoon. Talking about this point where we are when it comes to those still at risk of the virus and those vaccinated, the numbers, I know that this talking point about the pandemic eventually turning into an endemic has taken off, especially since the New York Times article over the weekend. If you're looking at our numbers right now, and if they stayed the way they are right now, what is the possibility of the virus just be kind of becoming a livable thing in our community? What's our likelihood of getting to herd immunity?
Well, there's several different concepts there, but we'll parse through them real quickly. I mean, we're holding steady right now at about 150 cases on average per day being diagnosed. That is much too high to be considered endemic. That is still an epidemic level of transmission. But even once we get to herd immunity at whatever point in time we do, there will continue to be cases of COVID-19 disease. There will continue to be some level of circulation of this virus in the world as long as it is uncontrolled anywhere in the world. And so the virus would just constantly seek for new opportunities to find a new host. But at an endemic level, it would be much fewer cases per day or month than what we're seeing now. We do expect, as with West Nile virus or SARS, the original SARS virus, that we will drop to a much lower level of disease transmission in the world. But right now, given the number of infections, given the number of people, given the number of countries that don't have any access to vaccine right now, we would be naive to believe that we will eradicate COVID. It will drop to a lower level of transmission that we are going to eventually learn how to live with, but we're not at that level yet.
Thank you. And Chief McGowen, just a housekeeping question. Do you have the total shots administered for last week? I didn't see that data pop up on the website or Twitter yet. And also the number of doses you ended up administering on the Jackson Avenue first day yesterday.
I don't have the exact numbers for last week, but I know it had rebounded from what was a low the previous week, and we are seeing a bit of an uptick even the last few days. So, and the Jackson Avenue site, I don't know where we ended the day yesterday, but at midday we had done 50 or 60 folks at about midday, and that's what we see anytime we open a new site. When we opened the Gill campus, we had 25 or 30 the first day, and 50 or 60 the next day, and then up to 100 the next day after that. So I don't know the exact number off the top of my head, but I know that there was enough folks that we said there is something here, and we're going to continue that work.
Jane Roberts, Daily Memphian.
I'm wondering if you will announce in relation to the governor's speech last week any changes on the masking mandate or business practices before the next health directive goes out.
Well, there's not going to be an announcement before the health directive goes out around the health directive. That's not anticipated. And let me correct something here. I've been advised of a couple things from our county attorney who's watching. Thanks very much, Ms. County Attorney. May 12th is when the next health directive comes out. May 12th is when the next health directive comes out. And that's to afford a 3-day window before it's effective on May the 15th. The second thing I was advised is she's looking forward to talking to her friends and loved ones about the opportunity to win a new car as long as they participate in vaccination. But again, to your question, Jan, no, we don't anticipate any early announcements prior to May the 12th when the next health directive comes out. Thanks.
Was there a follow-up?
No, thanks.
Hannah Grabenstein, MLK 50.
Good afternoon. I'm just wondering if you guys can check my math on this. If we have about the same number of people who are vaccinated as who are susceptible, does that mean there's about 60% of the community has some type of antibody, and we're looking at about 60, I guess 66 and 33, 2/3 who have some immunity and 1/3 who don't right now?
Yeah, so thank you for the math question. I wondered if anybody would come with that. So what we're at right now is about 33% of the population seems to be susceptible to the virus, vulnerable with no antibodies on board. About 33% of the population has received at least one dose of vaccine. So that takes us to 66%. So what happens to the rest? Well, the rest have been infected. Over the past 14 months, they've had COVID disease and have experienced that. So right now, we would say in Shelby County, the experience of the population is about 1 in 3 people have had the disease. About 1 in 3 people have been vaccinated, and 1 in 3 people are naive to the virus and will be the next cases of the virus as it continues to transmit in our community unless they join the vaccinated fraction.
Super, thank you. Did a little math today. And then Mayor Harris, I'm wondering if you can talk a little bit more about the community council. How were the people selected? How many people applied? What was the pool like? And then what exactly will they be doing to be ambassadors? Are they, using social media? Will there be events that they're attending or holding?
All right, so a lot of this is in process. Suffice it to say, we received dozens and dozens of applications, and the goal was to select folks who represented the diversity of our entire community, particularly in light of all of the effects that COVID can have on different populations. So there are obviously folks from communities of color, folks with children in school, and teachers and nurses, and as I said, frontline workers, all represented in terms of membership on the COVID Community Council. I think a lot of the kind of programming you see that comes out of it will be a function of some of our ideas, right, in the county building, but also a function of what the members of the COVID Community Council can come up with. And so one of the things that we're already working on, and we've already kind of seen the fruits of it, is to try to understand which zip codes have low uptake and where we might send out street teams in order to make contact with individuals in those neighborhoods such that they might consider vaccination. And so those street team efforts will go on next week, right? We'll be hitting up a low uptake zip code next week with the street team to make sure we connect with individuals in those neighborhoods to tell them about the importance of vaccination. But in addition to that, there'll be ideas that come from the members of the COVID Community Council, and I think a lot of those members have a whole lot of ideas they'd like to see brought forward, including, like you say, social media and so forth. So stay tuned. We hope to do a number of events generated from these members and from the community across the summer when we will surely need it in order to keep our vaccination rates up. Thanks for the question.
Laura Testino, Commercial Appeal.
Hey, this question is for Dr. Sweat. Following up on about the 33% in the community who have had COVID-19, what can you tell me about how vaccine immunity is different from immunity via infection, as related to long-term or immunity memory, as well as immunity to the different variants that we're seeing in the community, such as B117 and others?
Yeah, thank you. That's a great question. So what we've learned about, what we know from just immunology, right, the study of how the immune system works and how vaccines work, is that when you get a natural infection, your body produces a certain level of immune response, and there's antibodies left over that can be detected and differentiated in blood testing to say, okay, that antibody came from an infection. And then there's another kind of immune response that's empowered by the vaccination. And that is also has markers that we can tell that's vaccine-induced immunity. What we know is that from all disease and vaccination processes, that the immune response that your body generates from natural infection is not as strong as the immune response that gets created or sparked by vaccination. So vaccine gives you a higher level of immune response, a more robust level of immune response, and it's also a more durable level of immune response. So we would expect vaccinated people to have more antibodies ready to go, and that they would also be more durable, last longer. But that people with natural immunity will continue to, natural acquired immunity will continue to benefit from that for at least somewhere between 6 to 9 months. But after about that point in time, after about 9 months, blood testing may not show that immunity any longer. You would not see evidence of it. Now, further down in the body, in the T cells, there may still be in the memory bank of the immune system a T cell immunity that could be activated with infection, but it wouldn't show up on a blood test. So as far as the variants, the immune response that you get either way, from natural infection or from vaccination, is going to be based on the programming of the virus that infects you or the vaccine that you were given. And if a virus comes along that has a spike protein shaped differently or something like that, none of that prior programmed immune response will or at least the prior programmed immune response may not be as effective against that new virus. And so we see that with influenza. That's why there's an annual flu shot, because the virus continues to drift and change. And it remains to be seen, but at least some people have theorized that with COVID, that may be the case as well, that these variants could change. and that we might need a booster shot at some point in the future.
Was there a follow-up?
Yes, and my follow-up will go to Mr. McGowen. You might have said this, and so my apologies if I'm asking you to repeat yourself. But for this May 31st deadline with the raffle, is there a possibility that you can enter if you have had one dose with plans to prove that you have gotten your second dose after potentially being chosen, or is this raffle only for people who have received both doses of the vaccine?
Right, well, to be clear, it's a sweepstakes, so those terms are important under the Tennessee Constitution, so it's a sweepstakes, and it is open to anyone who's received any immunization, whether it's 1 or 2 in a series. So all you need to do is receive your first vaccination before that date, and then you have to enter on the website. Now, just to be clear, you're not automatically entered. So if you've received a vaccination already and you're a resident of Shelby County, 18 years or older, you have to go onto the website, enter your information, and that's how you're entered into the sweepstakes. So between now and May 31st, if you've had one or both, or if you're about to get one or both, please go get those shots. That's the most important thing. And then you'll be eligible to win the vehicle once you've entered your information into the website.
We are out of time. Are there any closing messages today?
Anything, Mayor, you'd like to offer? Am I eligible? Yes, sir. Mayor. Well, I think elected officials are probably not eligible. There's only a few folks that are not eligible, so it's elected officials and people directly associated with this effort. But we would certainly encourage everyone. This is encouraging news that David brought to us today. This tension between the folks who are susceptible still and the folks who have been vaccinated and those who have been infected. We really are approaching that point over the next 30 days that we could really get to a good point of, it's not just about lifting the restrictions. It's about being able to live our lives without having to worry about this. I think you mentioned it before, clearing ourselves from the pandemic. And the way that we're going to do that is to get more people vaccinated. So take advantage of the opportunity, the unique opportunity we have in this community that not many other folks have. We're using the incentive just to get folks out there, but it's really about what Mayor Harris said. Tell your friends and your family and the folks in your peer group that it's important to do this and do it for each other. And it's a great benefit for folks who wouldn't otherwise come out to have the opportunity to win a car for doing the right thing. So continue to get tested so that we have the data so David and his group can look and see where we are relative to reaching or approaching that herd immunity. Continue to advocate for people to get vaccinated, give a person a ride to a vaccination, and I encourage everybody to enter to win. It's an exciting time here in Memphis, Tennessee as we approach the summertime, so let's get across that finish line. Thank you.
Thanks, everyone. We'll be back on Thursday.